Hello, my name is Alejandro Quisa Lustino, and this is a presentation on anaphylaxis, which is also known as anaphylactic shock. So, what is anaphylaxis? And this is pretty much anaphylaxis is also known as anaphylactic shock, which is basic like a severe allergic reaction. It's a severe life-threatening allergic reaction. So, an example of that it would be if an individual is allergic to peanut butter, or if they're severely allergic to bee stings, or other insect and venom bites. And what are the causes of anaphylaxis? And it's pretty much when the body is reacted to an allergen, the body's immune system overreacts to that allergen. And what it starts to do is starts to begin to produce white blood cells in order to attack that invading substance. And the white blood cells are basically like a bodyguard in our bloodstream. They're here to, they'll help us. And again, like mentioned before, there were the causes of anaphylactic shock would be bee stings, insect bites, peanuts, or other food allergies. I've heard people who are allergic to tomatoes, strawberries, cherries, kiwis, bananas. Uh, Also with shellfish, a lot of people are allergic to lobster, oysters. What's another one? Shrimp, and also through medication. Like I'm personally allergic to penicillin. I don't get like a severe allergic reaction. My face just starts to swell up and puff, and my lips get really swollen, and that's when I know if I'm at the hospital, I've ingested or I've been taking penicillin. And those are all the other chemicals too, like over the counter medication, or they might ingest some formaldehyde. A lot of companies have formaldehyde when they work for as a way to in the chicken coops. They use formaldehyde to destroy the bacteria, and some people might ingest that. And what are the prevalence? How common is this anaphylactic shock? And the Mayo Clinic defines this as there's about 1,500 annual deaths that occur in the U.S. and approximately 2.8 million to 42.7 million of Americans are at risk. So they might be at risk, like saying if they come in contact with the allergen, something that makes them allergic, it might be a mild to moderate to severe allergic reaction. So, and again, once again, 1 in 50 Americans experience an episode throughout their lifetime. So they're going to experience an allergic reaction or some of the symptoms of anaphylactic shock throughout their lifetime. And what are the symptoms? So first and foremost, the main symptom is there's a difficulty breathing. And it's also the victim also when they're having an allergic reaction, they cough a lot, like they have something ingested, they want to cough it up. You know, whether it's in their lungs or in their stomach, they want to expel that substance. They sense the coughing, and they do that because they have the feeling of something that gets stuck in their airway or in their mouth or on their tongue. Also, swelling occurs. It can occur, like I said, through like the facial extremities, your cheeks, your eyes get really puffy, your lips. What else? Your feet might get swollen. If you get gotten bit anywhere in your extremities, it might get swollen. Really puff up and itchy. Also, itchy skin. You get really itchy. Uh, you start to feel like you might get hives as well. You might break out in hives. And also, if you ingested a chemical or like a substance that you're allergic to, you're going to experience stomach pain no matter what. Of course, you're going to be nauseated. You're going to have symptoms of feeling like you got like diarrhea, like you got to go to the restroom, some cramps, and of course, vomiting. And this altogether all causes anxiety. You tend to panic, and also your blood pressure begins to drop, and you're also in a state of shock. Like you can't move if it's really that severe. Like you're in a state of shock. I mean, you can't do nothing about it. Your body's reacting to the allergen, and ultimately you might lose consciousness. So it's so yeah. And the treatments to treat anaphylactic shock. And first and foremost is a lot of people see the epinephrine or adrenaline. That I wish I would have put a picture, but it's like a picture when someone's suffering from anaphylactic shock. They put that medication, looks like a cylinder tube. They put that in their thigh, and they're supposed to come out of it right away. Also, oxygen. They give the person oxygen because they might have trouble breathing. And they also might give them some medication through IVs. And that's just to open up their airways and to combat the allergen right away, right through the bloodstream, quick and simple. And also they have A beta agonists, which is kind of like albuterol, which is the picture. And a lot of people who might suffer from anaphylactic shock, or people who suffer from asthma as well, since it's kind of hard for them to breathe, especially when they go out for exercise, or when it's like they go and exercise in inclement weather, like when the smog is really thick and outside. That's another high factor which can increase to anaphylactic shock. And if someone is having an anaphylactic episode, first and foremost, call 911. Like, no matter how severe, I mean, it might be a mild case, but you always want to call 911. It's better to be safe than sorry. If the person can communicate, ask them if they took something that made them sick, if they're allergic to anything, you know. And if they did, if it's possible, if they have medication already, like on their persons or in their backpack, or if they're minors, like at the school's office, at the schools, make sure you locate that medicine. And again, stay with them until the medical AMRs or the medical assistants, the paramedics, they arrive, and from there they can take over. And some of the ways to prevent anaphylactic shock is to wear protective clothing. And some of that is like if you're severely allergic to insect bites, or better to wear some, like, not layers of clothing, but like a thermal, like Under Armour thermal. That way, there's no insects can crawl on you and bite you and stuff. Also, you should carry a bracelet, or if not, a card of all the allergies. That's why it's all documented. And make sure you have the proper medication available to you. Like I said, if you're a minor, for example, since I work in the school system, there's a lot of minors who have their medication at the nurse's office. So if we identify that student, oh, yep, he's these are his this is his medications on file. It's out the office. Let's go pick it up, or let's take him there. And also, if you're an adult, and you have severe allergic reactions, make sure you want to make sure you have an anaphylactic kit like this, your medication ready. You always want to have it in your car or in your break room, or if you're somewhere out in the public, you're hiking, you want to carry it, on your persons. And that's it. I hope you enjoyed this presentation, and thank you very much. Have a good night.